This is a very common condition that looks like acne, but isn't. So I'm going to go through a few of the ways that rosacea can present and how we tell it apart from acne. Let's start. The first is that with rosacea, it often presents not just with pimples, but one of the characteristic features is this central facial redness of the skin. Sometimes patients can also present with skin thickening, like off the nose, blood vessel enlargement called telangiectasias, then eye irritation, and periodic flushing or blushing. We have to be very clear what is diagnostic of rosacea and what is possible rosacea. Diagnostic features include what I just mentioned, which is that background redness of the central face, thickening of the skin, and then any two of the following features can be considered diagnostic for rosacea. That is periodic flushing and blushing, as well as inflammatory pimples. And that's really important to differentiate from acne because in rosacea, there are no blocked pores like whiteheads and blackheads. Telangiectasias or prominent blood vessels are also characteristic. And then ocular features such as dry sensation of the eyes, sometimes recurrently bloodshot eyes, and sometimes people also get little breakouts or pimples along the edges of the eyelid margins or flaking and scaling in those areas. Those are quite characteristic of ocular rosacea. The minor features are not characteristic, so we don't use them as a diagnostic feature. Some of those minor features include a burning sensation, a stinging sensation of the skin, periodic skin swelling called edema, or dryness of the skin. Now, importantly, facial rosacea can present in any of those permutations of redness, pimples, skin thickening, prominent blood vessels, and flushing. And it presents differently in different people. That's why making the diagnosis of rosacea is not completely straightforward. However, once it's diagnosed by your dermatologist, very specific treatment can be directed depending on what bothers you. For example, if it's mostly the background redness that bothers you, there are medicated treatment creams to try to temporarily reduce the redness. There are also energy-based devices like pulse light or laser treatments to tone down the redness on a more long-term basis. And for patients who have this periodic flushing or blushing, sometimes we use beta blockers. Those are pills that can calm the periodic flushing and blushing, or at least to reduce the intensification of the redness. Often, we also find that lasers and pulse light can help reduce both the frequency and severity of flushes. The next part are the pimples, the bumps, we call them papules and pustules. For patients who have milder forms, topical ivermectin, topical metronidazole, azelaic acid, those are all creams and gels, by the way, can be used in those patients. However, if it's more severe, adding or the addition of medicated pills like doxycycline or tetracycline may be quite helpful also. And for very severe or stubborn cases, we often use oral isotretinoin, the same medication that's used in acne, but in rosacea is used in much lower doses. And finally, for conditions like skin thickening and thickening of the nose in particular can be very problematic. We try to make sure that inflammation is reduced as much as possible, and then periodically, surgical procedures need to be done to trim and reduce some of that excess tissue. So in summary, with rosacea, it looks like acne, but it's not. It's treated differently than acne, and rosacea presents with clinical features such as that central redness of the face, the prominent blood vessel marks, skin thickening, eye irritation and dryness, pimples, and then periodic flushing. And each of these has a very specific targeted therapy to help. And this evidence-based framework is there to help patients improve their rosacea. So if it bothers you, seek medical attention, and your dermatologist can put you on the right pathway to improvement. I hope this helps. If you have any questions, feel free to comment down below and follow me for more information on acne and rosacea. Thank you.